Now, welcome back to the controversial issue about the Ebola quarantine facility. And questions continue over the government's plan to establish an Ebola isolation and emergency response facility in Laikipia. Meanwhile, the government has defended the location, saying Laikipia was selected because the site is located within a military installation far from population centers and is intended to strengthen national emergency response capacity. The government says a total of 18 samples from Ebola virus disease were tested across various regions, all of which tested negative. Risk assessment has identified 25 risk counties, with 12 classified as very high risk and 13 as high risk. Agutu Rosa with more.
Risk assessment has identified 25 counties under Ebola risk, with 12 classified as very high risk and 13 as high risk. The very high-risk counties include Nairobi, Mombasa, Uasin Gishu, Busia, Kisumu, Bungoma, Trans Nzoia, Siaya, West Pokot, Turkana, Homa Bay and Migori. The high-risk counties are Vihiga, Kakamega, Nakuru, Kericho, Nandi, Kiambu, Machakos, Makueni, Kilifi, Taita Taveta, Isiolo, Elgeyo Marakwet and Garissa. Concerns have been growing among leaders and residents of Laikipia over plans to establish a US-funded Ebola preparedness and quarantine facility at Laikipia Airbase within the county. Many residents have questioned why Laikipia was chosen and whether the facility could eventually receive Ebola patients from outside the region.
Kama viongozi wa Laikipia, na hii isikikwe kila mahali. Maneno ya kuja kutuambia tunajengewa rescue center ya Ebola na nyuki. Unajua na nyuki ni Singapore yetu. Sisi tumesema kama wakaaji wa Laikipia, kama wakaaji wa Nanyuki, hiyo Ebola Rescue Center hatuitaki Nanyuki.
Kama kuna center ya watu ya Amerika au kokote ya kupeleka watu kuwafungia kwa sababu wako na Ebola, hebu watengeneze kwao.
Kama viongozi wa Embu tumekataa katakata maneno ya kuleta agreement ya Ebola na kuquarantine watu ya Ebola katika hii nchi yetu ya Kenya, katika hii soil yetu ya Kenya. Kwa sababu tulikuwa tumesikia fununu ya kwamba governor anaongea pia kukuwe na quarantine huku Embu. Hiyo kwanza tumekataa zaidi ya zaidi.
Hii mambo ya kupenda hii pesa inatoka wapi? That you can even trade with the lives of the Kenyans. Sisi kama watu wa DCP na Embu, we have said no. We have said no.
Health Cabinet Secretary Aden Duale says those fears are misplaced. According to the Ministry of Health, Laikipia is one of several designated isolation and preparedness sites identified across the country. Officials say the selected location is situated within a military installation and is far from surrounding communities, making it suitable for monitoring, isolation, and emergency response operations should the need arise. During a recent assessment visit at Jomo Kenyatta International Airport, Principal Secretary for Public Health and Professional Standards Mary Mudhoni reviewed passenger screening procedures, laboratory readiness, surveillance systems, and emergency response mechanisms.
The Ministry of Health is doing whatever possible to ensure that we contain and we are prepared. At the ports of entry, we are doing screening. And in JKIA especially, we have designated Gate 16 for flights that are coming from those countries.
Although Kenya has no confirmed Ebola cases, health authorities say the country remains on high alert with enhanced screening, expanded laboratory capacity, and strengthened surveillance at air, sea, and land borders. As Kenyans display dissatisfaction with the decision, health officials are urging the public to remain vigilant, follow official health advisories, and seek information from credible sources as the country continues to strengthen its preparedness against emerging public health threats. Agutu Rosa, KTN.
Now, still on the same breath, the United Opposition